Hello and welcome to Healthy Kingston, a program of the Kingston Board of Health. I'm Janet Wade, your host. Today we're going to be focusing on women's health care and the common illnesses that women have and how we as women can all take care of ourselves. And I'm very fortunate to have two colleagues here with me today, a fellow Board of Health member, Heidi Whipple, is a registered nurse with a Bachelor's of Science in Nursing, and our newly minted doctorate in nursing, Christine Saba, who has an extensive background in oncology nursing. So thank you both very much for being here.
Of course, thank you for having us.
You're more than welcome. As nurses and as women, the three of us encourage you out there to take in charge of your health. All of us need to work in partnership with healthcare professionals and find out about our family medical histories, and we need to educate ourselves on the current health issues and paying attention to our bodies. Fortunately, many of women's health issues are preventable. You know what makes you feel good. You know when you don't feel well. Understanding your body is key. The three of us will be speaking on several health concerns common to all of us as women. Please keep these key conditions on your radar as we start the conversation so that hopefully you can pick up some further information on what you might be experiencing for symptoms or healthcare concerns you've already had diagnosed. First, I'm going to go into heart disease. It's the leading killer of both men and women in this country, and it's responsible for about 29% of deaths, as reported by the Centers for Disease Control. Yet death in itself isn't the biggest problem for women, believe it or not. The trouble is in premature deaths. There are far too many women dying of heart disease in their 60s, and that's way too young. There are also women who've had heart disease for years and are really ill with it. They might be out of breath, not being able to walk up a flight of stairs because of heart disease. And obviously this impairs their ability to get around. Although more men die of heart disease than women, females tend to be underdiagnosed, often to the point that it's really too late to help them. The symptoms for women are often missed by doctors and other healthcare professionals and the patients themselves, so it's very important that you know what they are. Chest pain, some people may have that, but others may just have a little bit of jaw pain, shoulder ache, nausea, vomiting, or shortness of breath. The American Heart Association lists a number of factors that we all need to be familiar with. Heredity, our background, plays a very key role in history of cardiovascular disease. People with a family history are far more prone to heart disease. African Americans, Mexican Americans, Native Americans, Hawaiians, and Asian Americans are more prone to heart disease. Those of us with high blood pressure, high cholesterol, physical inactivity, obesity and overweight, and diabetes are all high risk. So the burden of heart disease in women is very great. So the earlier you adopt healthy habits, behaviors, the lower your overall risk is going to be for heart disease. And those healthy behaviors, and we'll mention this several times in the next few minutes, are maintaining a good body weight, well-balanced diet, getting exercise, not smoking, and limiting your alcohol intake. The next area I want to address briefly is diabetes and obesity. Type 2 diabetes is in epic proportions in the United States, and it affects about 26 million adults, and almost half of these cases are women. Because obesity is a risk factor for type 2 diabetes, it shouldn't be a surprise that there's a similar trend for obesity. About a third of adults are obese, and the prevalence is pretty similar in men and women. And with the combination of these two conditions, it increases your risk of heart disease, stroke, and kidney disease. But again, you can prevent obesity and diabetes to a great extent with healthy diet and exercise. And also being familiar with your body mass index. Actually, if you go in and Google it, you can, you can put in your height in your weight, and it will tell you what your body, what your typical body mass index is. And typically you're looking for something between 18.5 and 25 as the ideal. Symptoms of type 1 and type 2 diabetes include increased urination, losing weight without trying, feeling tired and weak, feeling irritable or having mood changes, having blurred vision, slow healing of sores, getting a lot of infections, say in your gums, vaginal area, and skin, and the presence of ketones in your urine. And ketones develop when there's a breakdown of muscle and fat in your body, and there's no insulin there to help relieve that. Sometimes hormonal changes can also trigger type 1 diabetes. Lastly, I just want to cover briefly autoimmune diseases. They're a group of disorders in which the immune system attacks the body and destroys or alters your tissues. There's more than 80% serious chronic illnesses, and believe it or not, 3/4 of these autoimmune diseases are in women. And the most common ones are lupus, multiple sclerosis, and type 1 diabetes. According to the American Autoimmune Related Diseases Association, I mentioned about 75% of them are in women, and each disease appears to be uncommon. What is insidious about these is that the symptoms can be very subtle and very difficult to diagnose. So you need to advocate for yourself. If you know your body, you know you're not feeling well, you're having symptoms that you haven't had before, and pursue it with your healthcare provider. If they are thinking you're neurotic or you're not a good reporter, then go to someone else, because they can be very difficult to diagnose, but certainly very much there. And if you're at risk of autoimmune diseases, it's important that they be picked up very quickly. All right, with that said, I would like to refer now to Heidi Whipple, who is a clinical documentation specialist at Beth Israel Deaconess Hospital in Plymouth. And she's going to be speaking to us about maternal health and sexual health and urinary tract issues. So Heidi, take it away.
Thank you for having me, Janet.
Sure.
So when it comes to, I'm going to start with sexual health, because when it comes to sexual health, we need to start early. We need to start when we're potty training our young girls. They need to know to wipe from front to back. That is such a simple, effective way to keep your reproductive organs healthy. Another thing is cotton underwear. Everybody makes fun of the granny panties, but there's a reason the grandmothers are wearing them. Cotton breathes, and it helps wick away the moisture from that area, which can also decrease your risk of infection. Again, you don't want any fragrances down there, and gone are the days where people were talking about douching. It is not appropriate, and it actually can lead you to vaginitis and other infections. So when we get into STDs, we are seeing a large reoccurrence of syphilis.
Really?
It's come out again.
Wow.
I'm sorry to say, we're going to go back to talking about safe sex practices, making sure everybody's aware. You want to be using condoms. You want to be using oral dams. You really need to protect yourself.
What age group are you seeing this in? Has it gone down in age, the cases?
The cases they can come in as early as you become sexually active.
Okay.
You have to remember, every partner that you have, you've slept with all of their partners.
Right.
And STDs are very communicable, meaning they're really easy to catch.
Right.
Back to the syphilis, it's come to the point where now in pregnancy, that you will be tested at the beginning of your pregnancy and again at 28 weeks, because we have seen such a reoccurrence of syphilis within that population.
So concerning.
It's really concerning, because it had gone very dormant for such a long period of time.
Mm-hmm.
And to see it coming back is,
Yeah.
it
terrifying.
definitely makes all of us look around.
Right.
You know, we're even screening the elderly population at the hospital for if they come in with, we can't figure out what the infection is, we'll test them for syphilis.
Right.
Wow.
Yep. So back to STDs. Not a condom or oral dam is not going to protect you against all STDs. HPV is a very prevalent STD, and that can be just straight perineum to perineum contact. You don't even need intercourse for it to happen. They are saying now to start vaccinating your children younger and protecting them. There is the Gardasil is the HPV vaccine. So you can give that as early on as you need to, 10 or 12. You want to make sure you get it into them and have it be activated by the time they become sexually active. But you can also give it up to age 45, which I think a lot of people don't realize.
Yes.
So if you are one of those people who need to get out there and get your vaccines, go for it. We support you 100%.
Yeah.
Definitely encouraged.
Very encouraged.
Yeah.
With pregnancy, not only are we screening for syphilis so much, but we are also starting to educate women pre-pregnancy on the importance of optimizing their health. I'm going to reflect back upon what Janet said. You want to make sure you have a healthy diet, that your blood pressure is under control, that if you're looking pre-diabetic, that maybe you lose that 10% of your body weight, really get your weight down, and that you're drinking plenty of water. You're going to hear that over and over again. Water is nature's little miracle. It can help prevent a lot of things. It helps flush a lot of toxins out of your body and keep you from getting sick. They are treating pregnancy-induced hypertension a little more aggressively now. And also, the diabetes in pregnancy is being treated more aggressively. Some of the reason we might be seeing an increase in this is our population of pregnant people is becoming older. So as you get older, you have a higher risk of these things, as we know.
Right.
Yeah.
So if you just optimize your health before you get pregnant, healthy sex, it would really help get you there. And then as you move on in your life, we, as women, most of us have had a urinary tract infection.
Yeah. I hear them more and more often in older women.
So that's interesting that you say that, because what you actually want to make sure is that these older women are going out and getting a urine culture done. Often in postmenopausal and menopausal women, they experience vaginal dryness. And so it actually can be a vaginitis or an irritation mimicking a UTI symptom, because you'll have that burning with urination.
Right.
That we are trained to think, oh, I must have a urinary tract infection. But it's not. It's actually just vaginal dryness that's being suffered.
Interesting.
And with your younger people and anybody who's sexually active, STDs can mimic a urinary tract infection with that vaginal burning and discomfort.
Yeah.
Excellent points. I mean, some things that I certainly haven't heard before. And Dr. Christine Saba, who's worked, as I mentioned, in oncology nursing for quite a few years. If you could speak to breast cancer and what's going on in that field, that would be great.
You know, there's a lot of reason to be hopeful. I think we've made great strides in research for not only breast cancer but many cancers. As we all know, breast cancer primarily affects women, but it certainly can affect men. And men, unfortunately, it's more difficult to diagnose, and they have a poorer outcome. It's the second most commonly diagnosed cancer, second to skin cancer, which actually is interesting to me. 12.9% of women will experience a breast cancer diagnosis in their lifetime, but death rates have improved significantly in the last 10 years. According to the NCI, we have a 5-year survival rate now of about 90% overall based on most recent statistics, and that's lifetime for most breast cancers. So we are making some progress. You know, there's a lot of risk factors to be aware of, and to Janet's point earlier, you know, knowing your body, knowing your family history, and knowing your risk factors, I think is key for all of us, and they're highly individualized. Most of us are aware that lifetime estrogen exposure raises the risk of breast cancer. So if you think of estrogen exposure, that occurs from what age you start menstruation, if your menopause has a late onset, women who bear children later in life, and those women who don't bear children at all. They have a longer lifetime exposure to estrogen. So as a risk factor, those are important to remember. The lifetime risk of breast cancer, definitely older age is a risk factor. So when we think of screening for breast cancer, really it's best to speak to your clinical provider individually about when to start screening, and then more importantly, when to stop screening. That's a very individualized decision based on a number of factors. Certainly your hereditary factors and your family risk factors all play into your lifetime risk. As far as breast cancer screening goes, I want to always emphasize the importance of, again, to Jan's point about everybody knowing their bodies. Women are more likely to notice any changes in their body before anybody else, and that includes your breast health when you're in the shower, making sure that you're familiar with your own breast tissue, and obviously if you notice any changes, to bring those to the attention of your provider. So mammography is still the gold standard for screening, and that's a tool that's been around and has been widely used and is deemed very effective. As far as treatment options, as I said, research is ongoing and has made great strides. Most women, when they are diagnosed with breast cancer, will be referred to a team of oncologists, and that team will include a medical oncologist, a surgical oncologist, and a radiation oncologist. As far as the latest breakthroughs, certainly a lot of people have heard about immunotherapy being used in the treatment of cancers, not only breast cancer but other cancers as well. And immunotherapy is definitely emerging as a targeted therapy, and it uses the body's own immune system. And how it works is it prevents proteins from occurring on the cancer cells, and it prevents that replication over time for the cancer. So I think immunotherapy is something that we're going to continue to watch and to use across many, many cancer treatments.
That's exciting.
And it's very exciting, very promising.
Tremendous.
And osteoporosis. I think that's something that we as women, as we get older, it's sort of, we've watched our grandmothers, as they age, and they stoop and they fall and they have a fracture. Osteoporosis is something that has also enjoyed great strides in treatment and diagnosis. Most of us know that over time our bones become a bit weaker, and that actually starts as early as in your 30s. Your bones, they stop actually growing and they start decreasing in size and strength. So over time, there is a loss of bone mass. And that's, as we get older, that becomes more problematic and accelerates. Most people don't realize that the first symptom of osteoporosis is actually a bone fracture. So until you've actually fallen or had some sort of a traumatic injury and you've fractured your hip or your wrist, you may not be aware that you actually have osteoporosis.
Do you think that's due to lack of screening?
That's a good question, because we don't, typically bone density screening is not something that people will ask for on a regular basis. And so I think at your annual health maintenance exam with your provider, I think that's a conversation that should definitely be had between a woman and their provider to make sure that you have a baseline and can understand that.
Especially if you're starting to lose height.
Definitely, right. And so those are, when we think about symptoms, as I mentioned, like oftentimes a fracture is the first symptom, but if you have a niece or a nephew or a grandchild that's starting to tower over you, and they say, Grandma, how come you got shorter? Those are important conversations to have, right? It's definitely noticeable.
It can be
I'm
really
shrinking.
Easy way to
Yes.
pick
Yeah.
it up.
Yes. Yeah.
Stooping or bending forward. Sometimes low back pain may be an early indication of problems in your spine. And fractures with or without a fall. You know, if there's one takeaway message I could provide today with regards to osteoporosis is fall prevention. I think safety in the home is really key. So something as simple as making sure that you're never walking on a slippery surface without sturdy shoes or slippers with guards on them. Throw rugs. Spent many years as a visiting nurse, and that was one of the first things I would notice when I would go into a patient's home. Anything that's a tripping hazard. You can speak to your provider if you're concerned about your own home safety, having a physical therapist coming into your home, maybe doing an evaluation, maybe making some suggestions as to what you can do to promote your own safety. We just installed, much to her chagrin, my 84-year-old mother now has bars in the shower because, we're really concerned that if you're going to fall, the bathroom is actually one of the top 10 places that you're going to fall. And
Yeah.
So anything that you can do to promote your own safety, it's difficult, right? So people think that you're actually taking away their independence, but you are actually sort of supporting and promoting their independence by these very measures. Exactly.
Yep.
Yeah.
So it's a couple of things that people can do and just be aware of with regards to prevention of osteoporosis. Weight-bearing exercise. So walking, dancing, gardening, these are all very simple, easy things to do that are weight-bearing exercises and are very good for you. Making sure that you're eating a well-balanced diet. Again, to Janet's point, some of the things that we're kind of driving home today. Calcium and vitamin D are important to be eaten together. They travel together to the bone and they lay into the bone to make sure that the bones are strong. There's lots of good information out there about sources of calcium and vitamin D.
I know one of the big take-homes I always educate people on about calcium and vitamin D is you don't want to have it with your coffee. It's not your morning coffee.
It's a good point.
That blocks the absorption.
Right, it does.
And that really makes a big difference.
It does.
You need to take it, you're better off to take it before bed.
Absolutely. And I advocate for people to try to look for nutritional sources because I know that people, as we get older, we need those sources of calories as well. So that's a very good point. Smoking, as Janet alluded to earlier, can definitely impede the absorption of calcium and vitamin D. So if you smoke, try to quit, try to cut down, and don't start. And the same thing for alcohol. Definitely need to moderate that for bone health and to promote the absorption of calcium and vitamin D into the bones.
So obviously, this is a lot of information to absorb. And I hope, as I mentioned at the beginning, that you keyed in on those particular issues that you might be having or questions that you might be having. A lot of good information. Thank you so much. Do either of you have a takeaway? I know I have a couple, but I'll defer it to you first.
I think, healthy lifestyle choices, the weight-bearing exercise, water intake, eating a well-balanced diet, just making those healthy choices on a regular basis and a daily basis can really be very preventative for a lot of health issues that we discussed today.
I agree completely. If we just start making those healthy choices, it can be simple as making sure you move at least 10 minutes every few hours.
Yep.
Can really make such a significant change in your life.
Exactly. Keep an eye on your weight. Check and see what your BMI is, and keep that in check. As they mentioned, balanced diet, exercise, no smoking, limited alcohol intake. Know your health history. Know your body. Establish a good relationship with a healthcare provider that you feel confident in and you can have a good discussions with. And lastly, advocate for yourself. Advocate. If you're not getting the answers that you want, then move on to somebody else. So, and always look to those nurses. They're wonderful informants, and they've got your back. So, thank you. Thank you both, Heidi and Christine. Really appreciate your expertise. So,
Pleasure.
Take care and stay healthy. you.